This was a case series, or sorry, not a case series, just a case study of somebody that had post-concussion syndrome. And I'll just do the case. 19-year-old male sustained a head injury as a result of playing rugby. Post-traumatic amnesia for 4 hours, MRI that was unremarkable. 6 months later, no previous psychiatric history. Initially, he complained of dizziness, headaches, reduced speed of processing, underwent SCAT testing by his physiotherapist at the rugby club. And basically, they said that he had failed due to poor memory and balance scores, but we don't know if they actually compared that to normative or what. He was told that he had to pass the SCAT and be symptom free to return to his rugby. 6 months post injury, the player's dizziness was the only symptom that seemed to improve. 6 months post injury, he was referred to a neurologist who diagnosed him with post concussion syndrome and prescribed amitriptyline for headaches and referred him for neuro rehab. Player was assessed by a clinical psychologist 10 months post injury, underwent a series of outcome measures to assess his current concussion and psychiatric symptoms, as well as generating a cognitive behavioral approach to treating PCS. Here's the thing. A key aspect of the case was addressing two maladaptive cognitions. He thought that his brain was now very vulnerable if he sustained another injury of any kind and could have catastrophic consequences, mainly inferred from having to be asymptomatic and pass the SCAT before his brain was strong enough to sustain a blow to the head. The second one was that if he suffered any further concussion, it would make it that he would likely experience CTE and substantial cognitive impairment, inferred from the large number of reports in the in the media, which appeared to suggest this case. So here he is, terrified that his brain is vulnerable. He's going to get another concussion, and if he does, he's going to end up with CTE. So he's kind of sitting on the sidelines, having this anxiety caused by these maladaptive cognitive processes. Treatment, psychoeducation. They talk to him about the evidence. Here's what the actual evidence says. And this is why I drill this into our clinicians all the time, is that it's so important to say, here's what the actual evidence says. And the chances of this are extremely low. And we actually don't know what the long-term effects are of this. And CTE seems to be, a little bit misguided in terms of the media reports. And we don't have any evidence that the brain is more vulnerable, after a concussion, except for that first kind of 2-3 week period. And beyond that, we don't really have it. Anyway, so alongside his GP, he was signed off as fit to resume practice because he had 5 sessions of cognitive behavioral therapy. That was the only thing he really did, other than sleep hygiene, relaxation, increasing structure and routine, pacing to manage fatigue, increasing social activities outside of work, and providing alternatives to avoidant coping strategies, perfectionism, and hypervigilance. So 10 months, finally gets 5 cognitive behavioral therapy sessions where they just basically teach him that what he's thinking is actually not correct, and now he's back to feeling 100% and back to full play in the matter of a few weeks of cognitive behavioral therapy. Education is so important. Alleviating patients from their anxiety is so important. This is the number one thing you can do to help your patients, is to sit them down and be like, okay, what are your fears? Why, what do you think's going on? What are you worried about? Why, and then educate them, because it can have such a profound effect on how they recover.